Module 3, Communication, Interpersonal Skills. Section 1, Define Key Terminology. A. Review the terms listed in the terminology section. B. Spell the listed terms accurately. C. Pronounce the terms correctly. And D. Use the terms in their proper context. Section 2. The 5 basic psychological and psychosocial needs of all humans, as described by Maslow's hierarchy of needs. A. Basic human needs and how they can be met by nurse assistant. Number 1. Physiological. Oxygen, food, water, elimination, shelter, sleep, and sex. Example: delivers meal trays, assists patients or residents with setup and feeding as needed. Number 2, safety and security. Clothing, protection from harm or danger, freedom from fear, stability and order, family, and economics. Example: responds promptly to patient or resident's call light. Number 3, belonging, meaningful relationships with others, acceptance by peers and community, love, intimacy, and formal and informal social and work groups. Example: encourages family and friends to visit patient or resident. Number 4, esteem, respect, recognition, approval, self-confidence, self-respect, and self-esteem. Example: addresses each patient or resident by the name they prefer. 5. Self-actualization, achievement, creativity, success, full use of individual talents. Example: sincerely acknowledges a patient or resident's accomplishments. B. Value of using Maslow's hierarchy of needs. Satisfactory achievement of each level is based on meeting the needs of prior levels. Meeting basic physiological needs is essential to life. Provides a way to set priorities and organize activities. Encourages a holistic approach to patient or resident care planning. Increases awareness of reasons for patient or resident behaviors. And unmet basic needs may result from and/or contribute to illness, disease, or injury. Section 3. Patient or resident behaviors that reflect unmet human needs. A. Behaviors that demonstrate unmet human needs. Number 1. Physiological needs unmet. Irritability, weakness, complaints of hunger, complaints of being cold or too warm, changes in vital signs and level of consciousness. 2. Psychosocial needs unmet. Anxiety, depression, anger, withdrawal, isolation. Physical ailments with no apparent cause. Expressions of feelings of loneliness and worthlessness. B. Responses to patient or resident behaviors suggesting unmet basic needs. Look beyond uncooperative, demanding, and rude behavior. Recognize that a patient or resident has underlying needs for comfort and understanding. Respond with patience, caring, concern, kindness, and empathy. And if a problem continues, ask a licensed nurse for assistance. Section 4. Communication and therapeutic communication, and identify 2 routes of communication. A. Communication is a sharing of ideas, thoughts, information, and feelings with at least one person. B. Communication may be verbal or nonverbal. C. Therapeutic communication is used to promote optimum wellness, patient or resident centered, and goal-oriented, and can be verbal or nonverbal. D. 2 routes of communication: what is seen, heard, touched, internal senses, or what is spoken, written, or gestured, external senses. Section 5. The key steps involved in the communication process and methods used in communication. A. Important steps in communication: message, sender, receiver, and interpretation. B. Methods. Number 1. Verbal or spoken words. Number 2. Nonverbal, conscious or unconscious. Types such as body language, touch, eye contact at patient's eye level. Written. Labels, stickers, or armbands for patient or resident's precautions, room numbers, and unit signs. Visual labels, name tag, picture, uniform, picture board. Number 3. Electronic, devices to create sounds of words, verbal. Number 4, computers or touchpads to type words or phrases into screens for nonverbal. Number 5, specialized communication skills. A. Dementia-related communication skills including person-centered care, validation therapy, gentle orientation to time and place, reassure with words and touch. B. Use of continuum of verbal and non-physical techniques, such as redirect for combative patients. Section 6. Reasons for communication breakdown. A. Verbal factors. Can be the patient or resident or the healthcare worker. Criticism, value statements, interruptions, judgment, language differences, changing subjects, excessive talking, cliché or automatic answers such as "don't worry, it will be okay, I know how you feel." B. Nonverbal factors can be patient or resident or healthcare worker. Body language, eye contact, cultural beliefs, customs and practices, environmental time and space. C. Physiological and aging factors. Hearing loss, vision loss, slowing of response time, medication, cognitive changes, and speech loss. D. Not listening can be either the patient or resident or healthcare worker. Lack of concentration, preoccupied, distracting noises, monotone voice, or negative attitude. Selective hearing, what one wants or expects to hear. C. Emotional, verbal or nonverbal responses to words or situations. Section 7. Effective communication or interpersonal skills used with patients or residents and their families and guests. A. Communication or interpersonal skills for use with patient or resident, family or guest. Introduce yourself. Use the patient or resident's formal name initially. After initial introductions, ask the patient or resident how he or she would like to be addressed. Add this information to the nursing care plan so all staff members have the information. Explain all tasks to the patient or resident before doing them. Be patient and a good listener. Use short sentences. Ask for feedback. Use eye contact. Speak clearly. Avoid criticizing and avoid interruption. Clarify information or conversation as needed. Be aware of body language of self and others. Verbal and nonverbal messages should agree. Use words that are easily understood. Show interest and respect. Use a friendly tone of voice. Be positive while being appropriate to each interaction, and ensure confidentiality. B. Additional skills when communicating with patient or residents with special needs. Number 1. Language or cultural differences. Ask for an interpreter if the patient or resident or family speaks little or no English, or the language of the nurse assistant. Know cultural beliefs and practices for word meanings and uses, personal space, time and timing, gestures and touching. 2. Visual impairment. Describe surroundings to a visually impaired patient or resident. Encourage use of other senses. Identify self when entering the patient or resident's room. Speak aloud before touching the patient or resident. Explore the room with patient or resident. Do not rearrange the room. Provide the patient or resident with explanations about what will be and what is being done. Let the patient or resident know when you are entering and leaving the room. Keep doors open. Assist as needed with meal setup and eating. And speak in a normal tone of voice. 3. Hearing impaired. Gain the attention of the patient or resident using touch as appropriate. Determine which ear has hearing loss. It may be both ears. Check to see if hearing aids are in, turned on, and working. Face the patient or resident directly. Do not block or cover your mouth or chew gum. Reduce or eliminate background noise and other distractions. Speak slowly, directly, and clearly when addressing a hearing-impaired patient or resident. Do not speak loudly. Use short sentences and simple words. Repeat and rephrase statements as needed. Ask the patient or resident to repeat instructions to ensure understanding. And be aware of messages sent by facial expressions and body language. 4. Speech impairment, such as dysphagia or aphasia. Provide writing materials and assistance as needed. Let the patient or resident use their own words. Allow sufficient time for response. Use picture boards or point boards. Stand in front of the patient or resident, and avoid finishing words and sentences for the patient or resident. 5. Mental impairment, such as confusion or dementia. Keep directions simple. Repeat information as needed. Offer frequent general reassurance. And always have the patient or resident's attention before speaking. Section 8. Conflict and measures for conflict resolution. Definitions. Conflict, a disagreement or controversy, when what a person has and what a person wants is different. A pattern of energy, nature's primary motivation for change. Conflict resolution, a range of processes aimed at alleviating or eliminating sources of conflict. Conflict myths. Conflict is negative. Conflict is a contest. The presence of conflict is a sign of poor management. Conflict, if left alone, will take care of itself. Conflict must be resolved. Conflict handling modes, characteristics, and uses. Competing, assertive and uncooperative, power-oriented. Accommodating, unassertive and cooperative, self-sacrifice. Avoiding, unassertive and uncooperative, doesn't address the conflict. Collaborating, assertive and cooperative, seeks mutual satisfaction. Compromising, somewhat assertive and cooperative, mutual satisfaction, middle ground. Potential areas of conflict for the nurse assistant: attendance, punctuality, safety, including personal and patient or resident, professional behavior, attitude, appearance and hygiene, performance, and confidentiality. The 4 E's of giving constructive feedback. Number 1, engage. To prepare, link feedback with goals, focus discussion. Number 2, empathize, environment and timing. Number 3, educate. Describe your observations, identify impact of behavior, remain objective. And number 4, enlist. Elicit a response, guide towards a solution. Section 9. Touch as a form of communication, including body language and personal space. Cultural beliefs regarding touch. Modesty, the covering of the head, face, or arms. Gender of caregiver. Touching of the body after death. Hugging and kissing. Observing body language. Hand and extremities. Eyes. Gesture. Posture. Regression to childlike posture or behaviors. Personal space. Section 10. Identify common psychological defense mechanisms. Denial, projection, anger, rationalization, regression, displacement, conversion, repression, sublimation, substitution or compensation, and identification. Section 11. Family communication or interaction patterns and the role of the nurse assistant. A. General principles when communicating with patient or resident families. Show respect for all family structures and members. Listen to family members and show courtesy, respect, and support. Allow uninterrupted time and provide privacy as indicated. Avoid involvement with family matters. Maintain patient or resident confidentiality. Encourage family to participate in care planning and care as allowed by the facility policy. B. Provide information about the facility. Telephone numbers, cell phone regulations, visiting hours, location of cafeteria or vending machines, gift shop, public restrooms, orient to patient or resident activities, social services, and the chaplain. C. Encourage family to provide information about patient or resident preferences. Section 12. Social and cultural factors influencing communication and emotional reactions to illness and disability. A. Culture. Shared, learned customs, belief and values of a group of people. Includes attitudes, beliefs, religions, values, likes and dislikes, rituals, celebrations, food, and language. Culture influences the reaction of residents and families to health and healthcare services. Rituals. Ceremonies to cure or protect from disease based on beliefs about health, healthcare, and causes of illness. B. Physical and psychosocial reactions to illness and disability. 1. Stress responses. Common physiological responses vary with each individual, can become a pattern of responses based on experiences, and have desirable and undesirable effects. 2. Physical loss or disability. Loss of spouse, family, or friends. Loss of homes, employment, economics, and security. Loss of control of life, independence, and driving. Loss of control and function of body and mind, and fewer choices and options. 3. Emotional reactions. Anger, uselessness, fear, grief, feelings of damage, dependency, depression, suspicion, sense of helplessness, loneliness, anxiety, guilt, and frustration. C. Helpful nurse assistant actions. Observe the patient or resident for indications of emotional stress. Be a good listener. Take time to visit. Be patient and understanding. Meet needs promptly. Help the patient or resident function as independently as possible. Focus on their abilities, not disabilities. Let patients or residents know that the staff cares about his or her well-being. Be non-judgmental. Always treat all patients or residents with dignity. Be respectful of all cultures and belief systems. And take time to learn about cultures and practices. Section 13. Communication between the members of the healthcare team. Healthcare communication. 1. Methods of communicating. Verbal, nonverbal, written, such as chart, patient summary, care plan, report sheets, activity of daily living form, and weight and vital sign forms. Electronic, computer, fax, telephone, intercom system. 2. Legal aspects of communications. Must document what has been reported verbally to a licensed nurse. Must document statements heard from the patient or resident and family that are important. B. Rules for effective communication. Identify self by name and title in any form of communication. Verbal reports should be brief, organized, appropriate, and focused on diagnosis, allergies, activity intolerance, elimination, special needs, diet and appetite, vital signs and weight, and code status. Timely, respectful of patient and resident confidentiality. Telephone communication. Take notes during the call. Name of the person the message is for. Verify correct spelling of caller's name. Indicate time of call. Clarify the message with the caller by repeating it and repeating the telephone number. Clearly sign full name and title to the message. Answering a patient or resident call signal. Answer promptly, quietly, and in a friendly manner. If an intercom is used, call the patient or resident by name. Identify self and politely inquire as to the patient or resident's needs. Make sure the patient or resident can always reach the call light.